Hi. Okay, welcome back to Health Alert. Now, usually when you used to think like, I want to get rid of that wrinkle, maybe tighten some things up, you had to go under the knife, but that's not really the case anymore. A lot of changes when it comes to aesthetics, and for men and women, we have Dr. Milan Shah from Beautology joining us now to talk about kind of the newest things. Thank you for being on the show.
Thank you for having me, Erin.
Well, I kind of want to start with some statistics that came out when it comes to cosmetic surgeries.
Yeah, absolutely. You know, the American Society of Aesthetic Plastic Surgery, every year they put together statistics, nationwide statistics according to trends that are happening in both non-surgical and surgical cosmetic medicine. And speaking of men, we're definitely seeing an increase in males wanting non-surgical procedures. We're seeing a dramatic increase just over the last year, but if you look at the statistics since when we started tracking this stuff in the 90s, a huge increase. In the last year, men make up about a good 10 to 15% of patients going for cosmetic procedures, specifically non-surgical cosmetics.
And I just want to put this up real quick. The graphic you're looking at is the surgical stuff, but when you talk about non-surgical, it's like Botox, right?
Yes.
Or we like to call it Brotox.
Brotox, yeah,
Brotox, right?
Yeah, and both surgical and non-surgical numbers are up for male. We saw a 325% increase since 1997 for males searching out these procedures, both surgically and non-surgically. But of course, the non-surgical treatments seem to attract the male population a lot. We're seeing men wanting to do Botox a lot more, or Dysport, which are wrinkle relaxer treatments. The fillers have also gone up, as has hair removal and tattoo removal as well.
Well, and when we speak of men, hair loss is a big issue. So there's some exciting things that you guys are doing at Beautology, right?
Absolutely. So, traditionally, we do have our hair transplant surgeon that will, transplant these follicles back into the scalp. But again, this is a surgical procedure, and there's some planning that's involved. Well, one of the newest things we're doing for hair loss is basically a treatment called PRP, or platelet-rich plasma, where we're actually injecting the patient's own plasma, the plasma that has stuff in it that stimulates hair follicle growth, what we call growth factors. And as you see in these images, this is just after one treatment, a non-surgical treatment that's done right in the office, relatively comfortable, relatively little downtime, and we're seeing results just after a few weeks, as you see in these images right here.
And about how much does that cost?
Generally a lot less than, of course, the surgical procedures, not tens of thousands, but, in the thousands, if not less.
Okay. And now let's talk about laser resurfacing. So this is something, tell me more about this, because I always think of like sun damage. A lot of people have sun damage. Is this good for sun damage?
Absolutely.
Being in California, when I was a kid, we never put sunscreen on, Mom. Moms put sunscreen on, kids.
Yeah, no, absolutely. Sunscreen and, sun damage in general, we see a lot of it in California, but, throughout the Midwest as well. And it's why laser resurfacing, or lasers in general, have become so popular. Laser resurfacing is a procedure where we're actually taking off that top layer of skin. Here's speaking of our male patients, here's a male patient that had a laser resurfacing procedure, and you can see, we're tightening the skin, we're going after lines and wrinkles, we're reducing or turning back the clock significantly. So if a patient's looking for a significant procedure where they don't want to go under the knife, laser resurfacing is a great option.
Now, from before to after, how many treatments was that?
This is actually just one deep CO2 laser resurfacing. So there's different categories. We can go light, we can go deep. This gentleman actually had one deep CO2, and that was it. And this is about a few weeks after the procedure. So, there was some healing that was involved, some recovery, a little bit of redness. He had to stay at home for about a week. But you can see a dramatic results with just the one treatment.
Looks great. Okay, so we're talking about Botox, and you mentioned Dysport. So let's talk about Dysport now. What is that exactly?
Sure. So there's 3 different wrinkle relaxers, we call them, that we use in the United States that are FDA approved. Botox is kind of like the Kleenex of Botox or botulinum toxin or wrinkle relaxers. Dysport is another competitor competitor that's been around almost as long as Botox has around the world, and it's actually very, very popular in the United States now. It's something that tends to work just a little bit quicker than the Botox we see, and for large areas it spreads a little bit further. So for the forehead, we like the way it works. The newest one we have in our practice is Xeomin. Xeomin got its FDA approval in the United States a couple of years ago, and again, very similar characteristics to Botox and Dysport. It just takes care of those real deep frown lines, those laugh lines, those forehead creases, those lines that we don't want to see when we're taking those pictures, basically.
And how long does it last?
Typically about 3 to 4 months the first time you do it. Now, what we see is if you started early on, in your 30s or 40s, and you start training those muscles to stay relaxed, they don't come back as strong, and it does start lasting longer and longer. So there's a nice long-term investment to using these treatments.
Okay. Well, if you want to see pictures of before and after of Dysport, go to Beautology's website. You have all pictures before and afters. It's great to look at. As well as if you need any more information, the number is 844-Beautology, also beautology.com.
We have lots of great references, and those are all our patients before and afters, and these are very typical results. One of the biggest things patients, guys and girls, are worried about, am I going to look fake? Am I going to look plastic? And absolutely not. The point of these treatments is to just turn back the clock a little bit, give you a nice natural look.
All right. Well, thank you, Dr. Shah, so much.
Thank you very much.
All right. Health Alert will be right back.